holds on Friday a press briefing on the latest developments of the Hantavirus.
Thank you, Tariq. Good morning, good afternoon, and good evening. Today, I had a call with the Minister of Health of the Democratic Republic of the Congo, Minister Roger Kamba, concerning the new outbreak of Ebola disease in the country's northeastern Ituri province. Currently, WHO is aware that 13 cases of Ebola have been confirmed by INRB in Kinshasa, and on the 5th of May, WHO received a signal of suspected cases and sent a team to Ituri to support DRC health officials in their investigation of the outbreak and collect samples in the field, which initially tested negative for Ebola. Samples were subsequently sent to INRB, which yesterday confirmed some as positive for Ebola. This is the 17th recorded Ebola outbreak in DRC since the virus was first identified in 1976. DRC has a strong track record in Ebola response and control. I have also assured the Minister of our full support. The World Health Organization's representative to DRC and other WHO experts are in Ituri and working side by side with DRC health authorities to respond to and contain the outbreak. Additional WHO experts in risk communication and community engagement, infection prevention and control, clinical care and logistics will join the WHO team already on the ground in coming days. We have deployed medical supplies and protective equipment for infection prevention and control to Bunia, the Ituri provincial capital. Today, I have released $500,000 from WHO's contingency fund for emergencies to immediately support the response. Priority actions include risk communication and community engagement, strengthening disease surveillance, active case finding and contact tracing, infection prevention and control in health facilities, expanding access to safe clinical care, and increasing laboratory testing capacity. WHO will continue working to support the Democratic Republic of the Congo to bring this Ebola outbreak under control, and will deploy resources and work with and mobilize partners across the region to contain its spread and care for those affected. The outbreak is a reminder of the persistent threat to human health of disease outbreaks and the importance of cooperation and solidarity to continually strengthen global health security. The response to the hantavirus outbreak is a recent prime example of what can happen when the world comes together to confront a disease threat. Yesterday, I wrote again to the people of Tenerife to thank them for the solidarity they showed to the passengers and crew of the MV Hondius affected by the hantavirus outbreak. WHO worked together with approximately 30 governments, the ship's captain, crew and passengers, the cruise ship operator, and crucially the people of Tenerife to manage this crisis. This show of support from Tenerife will not be forgotten. Today, I hope the rest of the world is inspired by the spirit of the Tenerife and Spanish people. At a time of great division, tension, and uncertainty, we must respond jointly to common challenges that our global community faces in the spirit of cooperation. For as we at WHO always say, solidarity is the best immunity. I'm pleased to report that the operation to transfer the ship's passengers from Tenerife has been successfully completed, with more than 120 people now being cared for in their home countries or quarantined in host countries en route to their final destination. Captain Jan Dobrogowski and his 26-member crew are still on board the MV Hondius and expected to dock in the Netherlands on Monday. I remain in regular contact with Captain Jan and again salute him and his crew for their dedication to their passengers and each other. he has informed me that there are still no symptomatic persons on board as of today. WHO repeats that the risk from this event to the global population is low, and we will continue to issue updates as needed. As of today, a total of 10 cases, including 3 deaths, have been reported to WHO, including 8 people who were laboratory confirmed for Andes virus infection and 2 probable. There have been no passengers returned to their countries where they are being quarantined and tested in specialized facilities or at home. This does not mean the outbreak is expanding. It shows that the control measures are working, that laboratory testing is ongoing, and that people are being cared for with support from their governments. It's incredible to think that it was less than 2 weeks ago, on the 2nd of May, that WHO was first notified by the United Kingdom through channels established under the international health regulations of an unknown respiratory disease on board the ship. WHO immediately convened affected countries, shared information with all member states, worked with the government in Cabo Verde, Spain, the Netherlands, and beyond to coordinate the medical evacuation of sick patients and repatriation of passengers and crew. WHO rapidly developed and shared technical guidance for the disembarkation of the people on board and their repatriation home for quarantine and follow-up. WHO continues to coordinate the global response, and our work is not finished. Our current priorities are to continue actively following up on the status of confirmed and suspected cases, to continue to better understand the epidemiology of Andes hantavirus, including how this outbreak began and spread, and to foster scientific collaboration for optimal clinical care of patients infected with this virus. In addition, we're working with more than 20 countries to coordinate studies to better understand the natural history of the disease. Today, an open scientific consultation on Andes virus medical countermeasures was convened by the UK Health Security Agency and supported by the WHO R&D blueprint to identify gaps, improve coordination, and establish priorities for research and development into potential hantavirus therapeutics and vaccines. The importance of vaccines for protecting health cannot be underestimated. New findings on the RTSS malaria vaccine generated through the WHO Malaria Vaccine Implementation Program confirm that 1 in 8 child deaths were averted among those eligible to receive the vaccine in Ghana, Kenya, and Malawi from 2019 to 2023. WHO recommended malaria vaccines are now available in 25 countries in Africa, and wider impact is expected. But funding constraints continue to limit the abilities of many countries to scale up to meet national vaccination targets. Equitable access and increased and sustained financing of immunization programs are needed to protect children and save lives. These subjects and more will likely be raised during and on the sidelines of the 79th World Health Assembly, which starts here in Geneva on Monday. I'm looking forward to welcoming all WHO member states and the global health community to join this critical event. We will come together to take stock of the state of global health and find ways to deliver on our goal of achieving the highest level of health not for some, not most, but for all people on the planet. Put simply, to achieve health for all. Thank you, and Tariq, back to you.
Thank you very much, Dr. Tadros. We will now start with our session of questions and answers, and we already have a number of journalists who are ready to do so. For all reporters, please identify yourself in your name, in your Zoom name, and then click the icon raise hand if you have a question to ask. So we will start with Agence France Presse and Nina Larsen. Nina, please come in.
Yes, hi, can you hear me?
Very well.
Yeah, thanks. Could you tell me, sorry, about the Ebola outbreak? It would be interesting to know, you mentioned 13 confirmed cases, but do you have an overview of the number of suspected cases and also deaths? And also any information about the strain that's spreading, and what level of risk you consider for the locally, regionally, and internationally. And finally, sorry, on the Hantavirus, I was just wondering if we have any idea about the third person who died, where the body is, and when we might have a confirmation that that person was also infected. Thank you.
Thank you very much. I think we will start with Dr. Mahamoud on Ebola, and then maybe Dr. Van Kerkhove can help with the second part of the question.
Thanks so much. As Dr. Tedros mentioned, Democratic Republic of Congo has wealth of experience in managing. This is the 17th outbreak they're dealing with. So as part of the surveillance, alerts are being detected and are investigated on timely. So in the same province, we had two different signals that was investigated by the team. So I don't want us to go ahead of the government. Right now they're talking. They're looking at all the data. What does the 13 confirmed is coming from what suspected case and triangulating all of the data. So we are waiting for the government to announce the details of the investigation. The report is being compiled. What was released yesterday from the lab was confirmation and the entirety of the investigation that was going on since first week of April from different health zones. So as of now, we don't have the details what was the case definition used, who is a suspected, who's confirmed. All those information will come from the government. But we know very well that the country has experience, but the region where it is happening is highly volatile with the humanitarian situation going on and the population moving around from South Sudan to Uganda and other parts. So our response is to stand with the regional government, and the country neighbor in terms of solidarity to show again that they can control this outbreak. In terms of the species, INSP just had a press conference. I will refer you to that, and thank you.
Thank you very much, Abdirahman. Now maybe our regional director, Dr. Janabi, would like to add something.
Thank you, Tariq. Maybe let me just top up what Abdiv just said. DRC has got a lot of experience. If we all remember last year in August, when we had it in Bulape, which is a 5 days drive from Kinshasa, DRC has got a very strong public health services, and we went there to complement what the government is doing with other UN agencies and other non-UN agencies like CDC Africa. But I want to emphasize it's important to understand the geography this time. Ituri is 1,700 kilometers from Kinshasa. So underscoring the operational complexity of responding rapidly in such a remote and highly mobile settings. So Ituri prevent that challenging environment, and there are some security concerns which can sometimes limit some areas to be reached. Population movement is linked to mining, and cross-border trade accelerates the speed. So it's a very densely populated area, and this naturally increases the transmission rate. So we are dealing with two different environments comparing to. So at the same time, logistic constraints and the need to build that sustained community trust make the response even very urgent, needed. So I wanted to top up on that.
Thank you very much, Dr. Janabi.
Come back, the World Health Organization Chief Tedros Adhanom held on Friday a press briefing on the latest developments of the Hantavirus.